my name is Dr. Bhushan, but you can call me Dr. B. In this video, I'd like to discuss what is a biopsy. A biopsy is a procedure where the doctor removes a sample of tissue from mass caused by abnormal growth of cells. It is a test to see whether these abnormal cells are cancerous or not. The biopsy sample may be obtained in several ways, using different needle techniques such as fine needle aspiration. Your doctor uses a fine needle to withdraw fluid. This method is used for bone marrow aspirations, spinal taps, and some breast, prostate, and liver biopsies. This aspirated fluid examined by pathologist to detect cancer cells. Another one is core needle biopsy. Here, doctor uses a needle to withdraw tissue, which is solid tissue, and could be done under ultrasound, CT scan, or X-ray guidance. Once this solid tissue is obtained, which is tested by pathologists to evaluate for cancer cells. Another method of obtaining biopsy is through different endoscopy techniques. Doctor uses a thin lighted tube called an endoscope to examine areas inside the body. Endoscope go into natural body openings such as mouth or anus. Example of endoscopy exam include colonoscopy, which is an exam of colon and rectum. In this type of exam, an endoscope goes through the anus, allowing the doctor to examine the rectum and colon. Another one is esophagogastroduodenoscopy, which is an exam of your food pipe, stomach, and initial part of your small bowel, where endoscope goes through your mouth. To examine lung, we use bronchoscopy, which is examination of bronchi, lung, and trachea, where the endoscope goes through the mouth or nose and down the throat into the lung. Now, you can get biopsies through surgery also, where a surgeon removes an area of abnormal cells during an operation. Surgery may be excisional or incisional. In an excisional biopsy, the surgeon removes the entire area of abnormal cells. Often also some of the normal cells around these abnormal cells are removed. In an incisional biopsy, the surgeon removes just part of the abnormal area. Now, some biopsies may require sedative or anesthesia. Sedative are medicine that help you relax and stay very still or sleep during a biopsy. Anesthesia keeps you from feeling this pain. It can be a local anesthesia, meaning at site of biopsy, regional anesthesia to numb part of your body, or a general anesthesia, where patient is heavily sedated with breathing supported by a machine during this time. Your doctor will discuss what type of anesthesia is required based on what type of biopsy is suggested. Once we have this solid tissue or liquid fluid obtained, it's given to a pathologist who looks at the sample under a microscope and run further testing on that sample to see if there are cancer cells. The pathologist describes the finding in a pathology report, which contain details about your diagnosis. Pathology report plays a very important role in the cancer diagnosis as well as in treatment options. So let's summarize. A biopsy is obtaining cells for evaluation using different techniques such as needle, which could be fine needle aspirate, or a core needle biopsy, using endoscope such as colonoscopy, bronchoscopy, esophagogastroduodenoscopy, using surgery, which could be incisional or excisional, and obviously using anesthesia, which could be local, general, or regional. I hope this information about biopsy helped you to understand what it means. If you have any questions or comments, please leave that in the comment section below. It has been my pleasure to share this information with you, and I look forward to seeing you again. Exercise regularly, eat healthy, and stay fit. Dr. B signing out.